Good afternoon, everybody. Thank you for joining us today at Universal Healthcare Foundation. We're just a little less than a month away from November 3rd, Election Day, and there's a lot at stake this year in the elections. So we're here today to talk to you about what's at stake, to help model for you how to talk to candidates about healthcare issues and get good feedback from them that you can use as a voter in making your decision about how you'd like to vote on Election Day. And then we're also going to be talking about sort of the ins and outs of voter rights and how to make a plan to make sure your vote counts on November 3rd. I'm happy today to have Gretchen Raffa from Planned Parenthood of Southern New England and Evelyn Mantilla from Grossman Solutions with me. And we look forward to engaging with you in the course of our time together this afternoon and encourage you to send us any questions you may have in the chat box. We'll try to keep on top of them and get to them in a timely manner throughout this workshop today. So first thing I'd like to do is ask Jackie to do a screen share for me. What I'd like to do is talk a little bit before we go into the role plays that we're going to have about what's on the line. It's really clear that no matter, how the elections turn out on November 3rd, decisions are going to be made in Hartford and Washington, D.C. that are going to affect your health and the health of people you care about and affect the bottom line, your pocketbook and your household budget, and whether or not you can afford to get the care you need when you need it at a price you can afford. So I'm just going to highlight a little bit about what's at stake in Washington, D.C. from our point of view at the Universal Healthcare Foundation. Certainly there are many issues that affect healthcare that are at stake, but right now, first and foremost in DC is the fact that the Affordable Care Act is set to go before the Supreme Court the week after the elections for a hearing on whether or not that act will stand. And as many of you know who are on this call, there's a lot at stake there. Issues of whether or not people with pre-existing conditions will be able to continue to have coverage, issues about whether or not you can keep your children on to age 26 if you have a good health plan that you want to share with them, issues about whether or not expanded Medicare in the states, in our state, over 200,000 people have taken advantage of that program. What happens if that goes away? And our health insurance exchange, which offers people health care with subsidies, is at risk for just being taken right out from underneath our feet. The federal government is probably the best place to do anything about the cost of prescription drugs. And we know from surveys that that is a huge issue for people. People are cutting their pills in half, they're skipping medication. It's a travesty, and that's one thing that can be taken care of in DC. Protecting Medicare and Medicaid, depending on who wins the elections, those programs may be subject to some changes. And we know that they're sacrosanct for many people, and that's at stake. And then the feds have really not dealt with the next wave of COVID-19 needs. As we know, issues are stalled in DC and there's a lot at stake. For example, all the money we're getting here in Connecticut to pay for no out-of-pocket COVID-19 testing ends on December 31st. What are we going to do in the middle of the winter while COVID-19 is going on? So there's a lot at stake, not to mention the big issues of health reform, like, do we go toward Medicare for all or things of that sort. At the state level, it's really important what the legislators do and how they take action on these issues. The legislature in Connecticut can take decisive action to protect people who are struggling with the high cost of healthcare. And there are lots of ways that they can do that. And who's in office really does matter. We also could do a lot more in Connecticut to offer other options to people to get coverage. Small businesses and nonprofit employers, people who have to buy insurance on their own, could all do better if we had more options to offer them. We could expand our Husky program, which is the state Medicaid program. We could increase the eligibility for individuals and families, and we could also figure out ways to provide coverage for undocumented immigrants, who are a huge portion of the uninsured population in Connecticut and left out of so many options. And we could invest in all of the things that have been exposed during COVID-19, sort of racism as a pandemic in our society, all the inequities, and investing in things that would help improve people's quality of life and health. So we're gonna jump into a role play this afternoon. And what I've done is I've asked super duper advocates and activists, Gretchen and Evelyn, to join us today. And we're going to do 2 role plays. The first one is going to be focused on Gretchen as an average impassioned healthcare voter, talking to Evelyn as a candidate. And we're going to model 2 things. We're going to model in the first one a candidate that's more open to the ideas that the voter is asking about. And in the second role play, we're going to model a candidate that is more hostile to the ideas that the voter is putting out there. And what we hope to do today is give you a sense of what you can do as a voter to talk to your candidates about these issues and help you decide on how you're going to vote on November 3rd. And so without further ado, I want to hand it over to Gretchen and Evelyn. And I just also want to point out that in addition to being a super duper activist, Evelyn was a legislator in the state legislature for a number of years. And so she has experience at being a candidate and a legislator. So we're going to hand it over to them. We're going to do one role play, then we're going to pause, and then we'll go to the next one. And then after we get through the role plays, we're going to talk a little bit about war stories, and then get to some how to be a voter on November 3rd. So I'm going to hand it over to the 2 of you.
Thank you. Thank you, Lynn.
Thanks, Lynn. Sorry. All right. Hi, Evelyn. How are you? My name's Gretchen, and I'm a voter in your district, and wanted to take this opportunity to introduce myself because I'm a very concerned voter, and I'm getting more and more outraged every day as I watch what's happening in Washington, D.C. And like many Connecticut residents, Evelyn, I'm really concerned because healthcare is top of mind for me, and an important, probably one of the top issues when I go out and vote. And right now, too many people in our state are avoiding getting the care they need, or don't have a healthcare plan because they just can't afford it. And so I'm really happy to have the opportunity to talk to you today because, you know, specifically thinking about this year and how the coronavirus pandemic has really, that we've all experienced in some way, poses a continuous threat to millions of people across this country and the world. But in our state, you know, what is devastating is over 4,000 people have already died from this virus. And we know who is most impacted, or it's disproportionately impacting Black people and Latino communities in our state. And, you know, again, I'm really just frustrated because we can't depend on relief from Washington right now. And we need our state lawmakers to take action to make healthcare more affordable, more accessible to residents of our state, because people really need health and economic support right now, Evelyn. And I know you're running for office, and I really am interested to hear what your plan is to make sure that every resident of Connecticut has the choice to get quality healthcare coverage that they can afford, that they don't have to worry about going into debt for. And I'm hoping that you can share a little bit more about how you're going to make healthcare coverage more affordable for people in Connecticut.
Well, hi, Gretchen. It's really nice to meet you. And especially it's nice to know that you will be my constituent once I win this election and I have this seat in the state legislature. So I'm hearing you say that healthcare is a big top priority for you, and you're worried about a lot of people. At first, I really wanted to say you look very familiar to me. And I'm wondering, have you been coming to like all my events? Because I've seen you before.
Yes, well, I have been, because I'm really invested in making sure that the issues that I care about are, top of mind for the candidates that I'm going to vote for. So yes, I have been showing up because I'm angry, and I'm trying to put my anger to good use and make sure that my voice is being heard in this election.
Gotcha. Well, good for you. I'm glad that you're doing that. And I'm happy to see you at all of my campaign events. Absolutely. All right. So once again, I'm hearing you say healthcare is a top priority. You're making me think about how people are affected directly by all of the challenges that we have. And, my opponent has not done a good job at all in answering some of the questions that you have for me. So I hope that we can ask him the same questions at the same time. But let me tell you, I have thought about how people are being affected. I know that I'm lucky that I have an employer that is providing health insurance for me and my family. And although I'm really not that familiar with, and I invite you to tell me more about it, I'm not that familiar with how people who don't have their employer are getting their health insurance if they're not getting it through their employer. Because I know there's got to be some employers out there that are not providing the benefits.
Yeah.
How do they do it?
Yeah, well, and that's one of the concerns that I have as I'm, I know friends that are, have been without employer coverage and have relied on the health exchange, Access Health Connecticut, to get private coverage because, they've made too much for to qualify for Medicaid, and yet the cost on the exchange is still a little bit, it's difficult for them to afford, right? So one of the concerns we have is that kind of what are you as a legislator going to do to really address that, gap between folks that might qualify that won't qualify for Medicaid, but really can't afford the healthcare plans that are offered on the exchange.
I understand now. Very good. I really appreciate you giving me that information. It's really making me think. And, I had not yet had the opportunity. I've been dealing with so many issues in this campaign, and I had not yet had the opportunity to think about that gap that you're telling me about. So, I may not be able to give you a direct answer right now, but I'm promising you that I'm going to look into it and, see what the better answers might be to solve this problem. So do you feel that what people are accessing through the health exchange is still difficult for them to afford it?
Yeah, so that's the thing that I think is, as we are again facing this pandemic, the folks that might not be eligible for Medicaid need affordable options for healthcare coverage. And, and again, I can't stress it enough that what we know now is that people need more options, not less. And I'm really excited to hear that this is an issue that you care about and will look into some more policy solutions. And I actually would be happy to share some information with you, some information that I've gathered from the Universal Healthcare Foundation and the Connecticut Health Foundation, There are folks that have been doing this work in Connecticut to ensure that there is coverage for all people in our state. And so I can follow up with more information about some of the policy proposals. And I would love to have a continued conversation with you about this as we continue on, and hopefully see you in office so you can fight for healthcare for all people.
Well, thank you. Thank you. I appreciate that. So I'll tell you what, I would love to read some of that stuff. Okay. And, go on my website, and you can, the emails that you can get sent to me through the website, get directly to me. So I will make sure that I read your information. And then maybe the next time I see you at my next event, we can talk about it again. How's that?
That sounds great. That sounds great. I really appreciate your time today and spending time with me. And I'll be sure to send you an email with my phone number too, and we can set up more time to talk.
Beautiful. Thank you.
Thanks, Evelyn. Great to meet you today.
Nice to meet you. I hope I can count on your vote.
Thank you.
Thank you, the two of you. So as you saw in the beginning of that role play, the candidate was just being a little vague, but she left an opening for more information, and Gretchen took it up, and Gretchen mentioned that there are resources out there, good organizations that can provide more information. And she did also say that she would send her phone number and that she would like to have a follow-up meeting. I think as a little bit of a critique, I might have just tried to pin Evelyn down on, a promise to sit down and meet again before the election, and then should she get elected, right after she gets elected, to get her connected with some of those groups. But that was a good example, I think, of a candidate that is open to talking about the issue. And Gretchen had a nice combination in her discussion with the candidate about, sort of the emotional component of healthcare being a problem, without going too far down into giving her tons of studies and tons of statistics. It was a good opening conversation. So now I want to make sure we have plenty of time to field questions and do things after the role plays. So we're going to go into a role play where it's not going to go so easy, where the candidate is going to do some of the things that I'm sure many of you have experienced if you've tried to talk to candidates or legislators even. So let's do the second role play now then. I'll hand it over to the two of you.
Hi, how are you? I'm Evelyn Mantilla, and I'm running for the state senate in this district. It's nice to meet you. I hope I can count on your vote.
Hi, Evelyn. It's great to meet you. My name is Gretchen Raffa, and yeah, I would love to hear more from you, actually. Before I commit to vote for anyone, one of the things I want to talk to a candidate about are the issues that are important to me. And right now, I am a very concerned voter for many different issues, but specifically healthcare is top of mind for me this election. And like many residents in our state, it's an important issue when we go out and vote. And like many people in our state and people in my family and friends are really struggling to afford the high cost of healthcare. Specifically, I know friends that are really struggling to afford the cost of their prescription medication and their drugs. And the cost keeps going up and up. They end up, unfortunately, I'm hearing more stories from people I know that they have to skip doses. They might have to, cut pills in half because they just can't afford their regular monthly bills and their medication costs. So I would love to hear from you, Evelyn. Like, what are you going to do to protect people from the high costs of medicine and healthcare that they need?
Well, I'll tell you what, the first thing I'm going to do is get myself elected so that we can, work on a lot of these issues. But if, let me take a moment here. I have the list of all my voters, and you said you're Gretchen Raffa, right? I do have you on my list. I'm gonna mark you as a little bit undecided, right? Because you're not giving me a commitment to vote for me. And that means I wanna talk to you some more. But I know you're telling me these stories, and admittedly, I'll let you know that healthcare is not exactly my background. So I don't know a lot about it, but I know that if I get elected, I am going to rely on really good information from people that will be around me to help us do the right thing. But first, I got to get elected. So, I'm wondering, can I, get you to maybe come to my campaign and do a little volunteer so that you can see like what it's all about, and maybe that will help you make your decision, things like that?
Yeah, I think that I'm feeling a little surprised that, that healthcare isn't an issue that you're saying you don't know much about. And I would love to be able to have some further conversation with you about that today, because as we are, in the middle of a global pandemic that is, ravaging communities across the state and the country, I'm greatly concerned that people won't have access to the healthcare and medications that they need. So, people have insurance, but what's the point of having insurance if they have to struggle to meet deductibles or co-pays and paying for medicine? So I would really be curious to hear more about what your thoughts are on that particular issue before I commit.
I thought what was happening is that, because of the pandemic, I know a lot of people have lost their jobs, and we got to bring jobs back. That's one of the focuses on my campaign. But I thought a lot of people are losing their jobs, but that qualifies them for free health insurance. Aren't they being taken care of that way?
No, that's not the case, and not everyone has access to insurance coverage. And yes, unfortunately, one of the problems we have in our country is that private insurance coverage is connected to their employer, and we need to do a lot more to address that issue and make sure that that is not the case in the future of healthcare. Because not everyone that is unemployed qualifies for Medicaid. So not everyone can qualify for the Husky program depending on their income, because it is based on an income eligibility. And then if they go to the insurance exchange, Access Health Connecticut, some of those costs are too high, the premiums are too high, or they have the high deductibles, which is a huge problem with the insurance industry. That again, what's the point of having insurance if they have to pay so much? And so people are choosing to potentially not to buy a plan.
Let me ask you a question back, really quick. The district that I'm trying to represent, and I'm working really, really hard to get elected here. The district that I'm trying to represent includes Hartford and the Hartford area, which you likely already know has some health insurance companies in my district. And I don't have a background in health, but I have talked to some of the executives in those insurance companies, and my big priority is the economy. So I want to bring jobs back. I want to be all about people earning their own living and making it on their own. I'm not sure what would happen to the insurance companies. Won't they suffer? Won't they have to eliminate jobs, and that hurt the economy in the long run?
Well, what I'm really concerned about are the people and not the insurance companies. And as a concerned healthcare voter, what I am wanting to hear from candidates running for office is that they're going to put people over, big profit making companies. And right now, what we know to be true is that there is polling in Connecticut that I would be happy to share with you that actually, Connecticut adults believe the reason for high healthcare costs is unfair prices. And it's because of these powerful industries and executives within the insurance companies that are making insurance coverage inaccessible for so many people in our state. And so, you know, it's something that I want lawmakers and people in office that are going to put the immediate needs of people first, when we know that people are suffering and dying because they cannot afford and access this healthcare system. And we must do something, and we need elected officials in Connecticut who are going to rein in the drug companies so that people aren't, you know, that we're ensuring people aren't left with making these difficult decisions about paying for their drugs or putting food on their table and paying for their kids' meals. And that's what I want to hear from candidates that are, you know, running for office this year. And again, in the middle of a global pandemic, I want to hear this is about the people before the profit of the insurance industry.
No,
to
but
be honest with you.
again, Gretchen, if aren't these the executives that are creating all these jobs? Like, you know, I got people in the district that I'm hoping to get their vote, and they work for these insurance companies. They can lose their jobs, and I'm wondering, I'm just wondering, you know, what if you're a family guy and you have an insurance company job and you lose that job, you know, what are you going to worry about most? You know, putting food on the table, or are you going to worry about, you know, health care? You know, it seems to me like you got to put food on the table first and pay for your mortgage and pay your bills. So you got to have a job. So you understand my perspective?
Well, I think I'm going to have to cut it short soon. So is there anything you want to say to wrap it up, Gretchen?
I hear your perspective, and what I'm asking for any candidate running for office is also to hear one of the biggest concerns on people's minds and voters in Connecticut is healthcare, and you know, and making sure that healthcare is accessible and that is connected to the economy. And so I would love to set up a time to talk with you in more detail. And share with you some of the information that I have about the need for healthcare and how this pandemic has really been impacting people in our state. And so I'd love to have a further conversation with you.
Okay, we can do that. Come by the office for the campaign and we'll talk. I need your vote.
Thank you. Thank you, the two of you. So you saw sort of the very transactional way that many candidates want to deal with voters when they're talking to them, which is like, give me your vote, give me a commitment. I have my little sheet and I've coded you from 1 being supportive to 5 not being supportive. And I want to check off where you are on this box. You note that that Evelyn was looking to see if Gretchen was a registered voter. That could impact how responsive the candidate may or may not be to you. And the candidates happen to know whether or not you're what is called a prime voter, which means that you vote in all the elections, not just an occasional voter. And so it's a transaction here. And I thought that Evelyn was actually a little bit nicer than somebody who might be a little hostile, but she was trying to get Gretchen's vote. I think, you know, if I were trying to close the deal a little on this, that I might, if I were Gretchen, have said, I don't really think, you know, we're getting anywhere in this conversation. What kind of information would you like from me to help you make a decision? And then I need to hear from you before I vote what your decision is going to be on how to move forward on this. I know I had to cut you guys off because I wanted to leave time. I mean, we're getting some questions in the chat box focusing on homeless and mostly single payer issues. But one question that was put out is that there's a question about as a candidate or an advocate, what kind of information do you think is helpful to get in your decision making? Like as an advocate, what do you think is good to share? Evelyn, as a candidate, what do you think is good to get?
All right, if you don't mind, I'll jump right in and talk from the perspective of the candidate. So I know that, if healthcare is not my top issue, but I obviously need to be educated on it. One of the things that Gretchen did do really well also, overall, you did wonderful in challenging me, but you also told the personal stories. And so I would like to, it would be helpful to me as a candidate if I get some written information that is very succinct for me to look at. But even more powerful than written information is if you are a constituent, or you can bring me a possible constituent who has a story to tell. Gretchen, when you told the stories of real people, that's when I started to, as a candidate, pay a little bit more attention. But if you bring me someone in my district who has a real story, and unfortunately, because of the transactional nature of it, I want that person's vote too, I'm going to pay a lot more attention.
Is there anything you want to say, Gretchen, about information?
Yeah, I would just echo what Evelyn said, because I think the personal stories are the most important thing. I mean, as someone that's been doing advocacy for a really long time in Connecticut, lawmakers and candidates don't necessarily want to hear from me. They want to hear the real life impact their decisions and their positions have. And so having those stories is really critical, as well as having local or statewide statistics. Oftentimes when we bring in national statistics, it's much more about like, yeah, but what's happening here in Connecticut?
Right. I'll give you an example of that. When in 2017, for the Protect Our Care Connecticut Coalition, of which Planned Parenthood and Universal Healthcare is a part, we were talking to legislators about what was at stake with the Affordable Care Act. And we were able to give them in their town, in their district, how many people were on Medicaid, how many people, took advantage of Medicare, how many people took advantage of the health insurance exchange, or were uninsured. I mean, just very local statistics like that, a few of those, as well as a few good sources, and as good dependable sources. Like if there is a poll or a survey that has been done recently about what voters are thinking, that's helpful to share. And Gretchen, I think Evelyn pointed out very well that a story, like if Gretchen had said, my sister Maria, who blah, 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 and gave Maria's story, or Gretchen gave her own story. I think Gretchen was talking a little in generalities about people having to do things. If she could give a specific example to Evelyn, that may be even more compelling. It's really called in the advocacy world, which is putting a face on the issue. It's pretty hard for somebody who even disagrees with you to argue with you if you're telling them a factual story about a person that you know and love. I'm going to just sort of transition here for a few minutes into, were there any sort of war stories that you'd like to share with the people on the webinar today? Success or failure stories, but mostly success would be good.
I would love to defer to Gretchen because I know I've seen a lot of her advocacy work and it's exceptional. So you have to have, you've been through the war, so in and out. And then
yes, well, I was, as I was thinking about this today, I was thinking about the conversations we had, right after the 2016 election with elected officials in Connecticut about what are we going to do to protect the ACA, and then shared a little bit about the information that we were sharing with folks. And some of the most challenging conversations were people that support healthcare access, but the first year of the fight to protect the 10 essential benefits, a lot of the conversations I was having at the beginning of that legislative session in 2017 was, well, that's not going to happen, like, because it didn't happen yet. There was no repeal of the ACA, and we're jumping the gun. And I I had more conversations with lawmakers like that than I had expected. And, you know, one of the things that I think, again, is really important when you're having these conversations is to bring the personal stories in, because sharing, you know, stories of the people, the patients that come to Planned Parenthood for healthcare, how the Medicaid program is such an essential program and insurance source for people that come to Planned Parenthood, and what the Affordable Care Act did by expanding Medicaid. So, but I'm sharing that not as a war story, but just as a kind of a surprise, and like, be ready to have those conversations with candidates and lawmakers, because sometimes we feel really removed, I think, from what's happening in DC. And, you know, as an advocate going into that first session, trying to fight for that bill, I thought it was going to be kind of an easy fight. And I know that's probably silly for me to ever say, because no policy fight is easy, but because we knew what was promised by the federal government with a Trump-Pence administration, I thought it would not be as difficult to move that forward. And some of the challenges in conversations with lawmakers was because of what the insurance industry was saying, you know, and so trying to come to some compromise on some of the bill language was really one of the challenges. And again, it really is the personal stories that we were able to bring in, I think, and the direct actions that were happening at the Capitol, and the Universal Healthcare Foundation was a big part of planning those direct actions. And Protect Our Care really made sure that we were in legislators' faces repeatedly, reminding them about the impact of what the Affordable Care Act has done for folks in Connecticut, and what it means, what the threat meant on the state level.
I think
Yeah.
I think one of the things that we want to convey in this conversation today is that it's a process.
Mm-hmm.
You're likely not going to get a candidate or a legislator unless you already have a relationship with them and you already know that they're predisposed on your issue. They have a track record on the issue or whatever. You're likely not, you know, going to get to closure on a commitment to do something unless you are willing to engage in the process of developing a relationship with them. And I think one thing that a lot of people do is that they want to go up to the Capitol, or they want to talk to somebody on the campaign trail, and they want to get a pledge right then and there. And especially with legislators that aren't decided one way or the other, I think it's really important to establish that you want to have an ongoing conversation with them, and that you want to make sure that they're conferring with you as they're trying to figure out where they go on this issue. Usually candidates and legislators are pretty surprised if somebody says, I want to meet you again. I want to talk to you again about this. Wouldn't you say so, Evelyn?
Oh, absolutely. People can be surprised of a legislator giving them that opportunity.
Right.
So in follow up to that, you know, I think that what I would say is that the next most important thing is to do your follow up. You know, whatever you promise as a advocate, you must make sure that you follow through. So, you know, Gretchen offered me more information. I know Gretchen is going to make sure that that gets to me and that it's put in front of me one way or the other. And that's really important to both keep the issue top in mind for me, keep me thinking about it, but also impress upon me that, you know, she's committed to this. She's not alone. She has a whole lot of people that are working on this. And, you know, she's not going to give up until I get educated appropriately and make the right decision.
So I just want to get to some of the questions that are in the chat box. I know, or comments. Stefan, I know you well. You're with Medicare for All. You're an advocate for single payer. I don't think most people in this discussion today would disagree that the goal is quality, affordable, universal health care for every resident of the United States and resident of the state of Connecticut. And it's not that we don't want to go down that conversation pathway on Medicare for All or single payer right now. We know that there is a bill being drafted right now by members of the Progressive Caucus in Connecticut on single payer. for Connecticut. And we know that after we get through the elections at the federal level, there will be a return to what the future of our healthcare system is in the United States. And we're happy to have you be a partner with us as we do this work. There was another question asked about what to do for the homeless. And I just want to point out that from a perspective of healthcare, many people who are homeless, depending on what their circumstances are, would qualify for Medicaid, for the Husky program. There are adults who are homeless without children whose Medicaid or Husky coverage might be at risk if the Affordable Care Act was taken away. So, currently there probably aren't enough resources in the entire spectrum of need and access to the kind of care that people who are homeless and low income need, particularly when it comes to specialty care. But I would urge anybody who is homeless to take advantage of the local community health centers in their vicinities, because those are places where you can walk in without a dime in your pocket and without coverage, and they can help you get coverage. And or if they can't help you get coverage, you don't have to pay anything if you don't have the income to do so, and you can still get the care. So is there anything I'm just trying to keep track of time to make sure we don't keep people too much longer. Is there anything you want to say, Evelyn or Gretchen, to wrap up before I go into a few minutes of resources, and we have some slides to share with folks on that. But first, any 30-second wrap up on either of your part?
Sure. Having served as a legislator, I served for 10 years, which means that I ran 5 times. And therefore, I was that candidate that many times. If there's one thing I learned is that, people, the great majority of people are living their lives day to day, trying to help their families survive and thrive. And their voices are really not there. And therefore, advocates who fight for them and advocates who are, pushing the issues that are going to help those families are extremely valuable in the community of public policy. So, advocates in the issues that we care about the most also matter a great deal. They are up against a lot of forces. It's not just the forces of legislators that may not be educated enough or stand in the wrong positions, but there's the forces of the lobby of the opposition, of the lobby for insurance companies, the lobbyists that advocate for opposing issues, and they tend to have more resources, more money to bring to the table through campaigns and any other sorts of ways. So, consider training just like you are today to be an effective advocate, and know that there's, in my opinion, there's no other great a job and as effective a job as those that that people like Gretchen do.
Hear, hear. Gretchen, is there anything you want to say to wrap up?
I just want to echo what you had said about relationship building, because honestly, I think that's one of my most important things that I share with anyone about advocating for policy change, is that building those relationships actually get through the help you get through tough conversations. And so asking candidates or a legislator for their phone number and using it is so important, because you might become that point person to them when there is something that they don't know, if they're not experts on the issue, and helps us get to a place where sometimes you can actually, I have been able to, really have those intentional conversations with lawmakers where we can move them on a position, or they can see a different perspective that they weren't seeing until you had those continuous conversations. So I will stop at that, but it really did make a big difference in the fight to protect the ACA, and making sure that we got some of the things that went a little bit beyond what the ACA covered for specifically women's healthcare.
Mm-hmm. I just want to respond to a box comment. I'm not suggesting that people don't ask about single payer now at all. So I'm sorry if you misunderstood it. If that's something that's important to you as an advocate, you should be asking about it now. Now I just want to get a couple of slides up. I have 2 slides to share with you to talk about how to make sure your vote gets counted. Once you've talked to candidates and gotten their input, I want to make sure that you have a plan to vote. And I just want to bring up a few points. This is not like a normal election year. I think we all can agree to that. COVID-19 and the uncertainty and the protests and everything are making people much more concerned about getting out to vote on November 3rd. And yet we are a lot of things are thrown at us, like, is it safe to go in person and vote? Or will I be well enough on November 3rd to go and vote myself? We're hearing in the news that there have been moves afoot at the federal level to make cuts, and they actually have done that to the United States Postal Service. And there are questions about how quickly they can turn around ballots and things of that sort. And there's just a plethora of misinformation out there. I mean, everywhere you turn, especially through social media and in media, depending on which outlets you pay attention to, you may be hearing very conflicting things. But there's some good news for voters in 2020. And one is that we now have time, we have a month, we can make a plan about how we're gonna make sure our vote gets counted. Every registered voter in Connecticut was mailed application for a mail-in ballot. And the legislators changed the rules this year that any voter, regardless of what you're doing on November 3rd, can choose COVID-19 as the reason that you want to get your mail-in ballot sent to you at your house. We also have some other protections in Connecticut. You don't need to use the US Postal Service to deliver your completed ballot when you get it. And they're being sent out to folks right now. You may have already gotten it at your house if you requested one. You can drop it off at the secure drop box outside of every town or city hall in the state of Connecticut. They are secure drop boxes where you can just plop in your ballot or your application, and it will be picked up on a regular basis by the appropriate officials from within town hall and processed the right way. There have been questions raised about whether or not you can vote in person on November 3rd, even if you requested an absentee ballot. And the answer to that is yes, as long as you have not mailed in or dropped off your absentee ballot. So you could have your absentee ballot sitting on your desk at home, and you could decide closer to November 3rd if you wanted to use it or you wanted to go in person. But as long as you didn't drop it off in that drop box or put it in the mail, you can go vote in person. And then if you fail to do all of that, I just want to point out that for new voters, the last day to register is October 27th this year. But if you didn't do that and you still want to go vote on November 3rd, there is election day registration. And there's one location in each town that is processing people on November 3rd to register to vote and to vote. And that is available in each town. Can we go to the next slide? I just want to say that there's tons of information. We have a voter toolkit in English, and it will also be available in Spanish that lays a lot more out in detail. But if there's any question about where you can get your information about voting, it's myvote.ct.gov. That is the Secretary of State's website. That is where you can go to find out if you are registered, if you requested an absentee ballot, whether or not that has been sent and all that sort of stuff. Also, There's information on that website about who is on the ballot and what questions are on the ballot in your local voting place, like a sample ballot that you can look at. There's information on that website about who the candidates are that are running for state representative and state senator in your district. So if you want to talk to people like Gretchen was talking to Evelyn and you don't know how to do it, you can go to that site and look up who those candidates are and how to get in touch with them. But candidates will be reaching out to you. They will be sending you mailings. They may be door knocking in your neighborhood. You can talk to them then too. I just also want to point out that aside from all the great information that is in our voter toolkit, which you can sign up for online, there is also important to keep in your pocket on election day if you or any of your friends run into trouble. Because we all know, especially in the cities where things are a little more chaotic in some of the voting, some of the polling places, or if a person shows up to register to vote on election day and they're stuck in a line and they're being told conflicting things, or they're told they're not registered to vote and turned away, or they have a problem with things on election day, there is a hotline where people are on call to help you that day. And the hotline number is here and it's in our toolkit and it's on the Secretary of State's website. Polls are open from 6 a.m. to 8 p.m. And there's a lot of PPE and good cleaning that's going on in the polling places and extra staff that are going to be available in those polling places. So if you feel more comfortable voting in person, you can certainly do that on election day. So I urge you to check out our toolkit and check out the Secretary of the State's website. If you're hearing mixed messages on social media or on cable news shows or whatever, or from your friends, go check it out. It's all available. Those answers are available there on that website. Don't believe the rumors and innuendo. Take advantage of the options that are open to you this election season. Get educated about the candidates and make sure your vote counts on November 3rd, because we're going to need you all with us after November 3rd to fight for the things that we all need. And so with that, I'm just going to wrap it up and thank you all for joining us and urge you to go check out our toolkit. Thank you.